Okay, I'm Brittany Lackey. I'm going to be doing the musculoskeletal video checklist. So initially, I would be inspecting his shoulder. I'll be looking at the shoulder girdle anteriorly, the scapula related to the muscles posteriorly. I'm looking for any swelling, any deformities, any muscle atrophies, any tremors of the muscles, anything like abnormal positioning of his shoulders. I'll be looking at any kind of color changes, skin alterations, unusual bony prominences or contours. And then we're going to test the range of motion. And so, Randall, you can look at me. First, we're going to test flexion. So you are going to hold your arm straight out in front of you, and then you're going to raise it above your head. Okay. And then extension, you're going to go back behind you. Okay. Abduction, you're going to hold your arm straight to your side, and you're going to move your arm up and move your arm down for adduction. And then you're going to bring it up. Wait, hold on. No, adduct. So it'd be going back and trying to touch your scapula. Okay, other side. And then we're going to check the rotation. So you're going to hold your arm out, and then you're going to move your shoulders like this. And then back. Go back. And then we're going to look at the elbows. So we'll inspect his elbows. I'll be looking at the contours of the elbows, both of them. The surfaces. I'll be feeling for nodules, any kind of swelling, tenderness, any warmth, redness that might suggest some sort of inflammation. And then we'll test the range of motion for those as well. So for flexion, I'm going to have you bend your elbow. Okay, for extension, straighten your elbow. You're going to turn your palms up as if you're carrying a soup, and then you'll turn your palms down. And then that tested for supination and pronation. Then we're going to look at the wrists and the hands. I'm going to inspect the position of the hands. The fingers at rest should be slightly bent. Then look at the fingernail edges. Everything should, any kind of redness, any kind of nodules, anything like that. I'm going to look at the wrists, the hands, the fingers, the joints. I'm looking for swellness or swelling, deformities, any sort of atrophy of the palms that you would see in the hand or even on top of the hands, or any kind of thickening, contractures, anything like that. And then we will test the range of motion of the wrist. So for flexion, I'm going to have you put your palms down, and then you're going to point your fingers toward the floor. For extension, I'm going to put your palms down and then point your fingers toward the ceiling. For abduction, with your palms down, I'm going to have you move your fingers toward midline. And then for adduction, I'm going to have you move, so just the palm, just your fingers, and then you're going to move your fingers out to test for adduction. And then with your fingers, I'm going to have you, we're going to test the flexion of your fingers. So I'm going to have you bend your fingers into your thumb to make a fist, and then you'll straighten them out. You're going to spread your fingers apart for abduction, and adduction, you're going to bring them back together. And then with your thumb, I'm going to have you move your thumb across your palm to touch the base of the fifth finger to test for flexion. Extension, I'm going to have you move your thumb back across your palm and away from your fingers. For adduction, you're going to place your fingers in a neutral position with your palms up, and then you're going to move your thumb out, making like an L with those two fingers. I'll hold them out. Yep. And then you're going to bring that thumb back into your palm to test adduction. And then opposition, I'm going to have you touch your thumb to all your fingertips, and that will test opposition. And then I'm going to be looking at his spine. So I'll have you turn around. And then this assessment happens when you first enter the room. I'm going to be looking at the position of both the back and the trunk. I'm going to be looking for smooth coordinated movement when he's walking into the room, when he's moving about the room, during all these other tests, the ease of his gait, and then the neck movement. And then I would be lifting his shirt up. I'm inspecting the cervical spine, the thoracic, and the lumbar spine. I'm going to know any deviation of the spine where it's not straight, any abnormal prominences that might indicate any sort of like underlying scoliosis, And I'm gonna inspect C7 through the gluteal cleft where you can see that it goes straight down. It should make a direct line. I'm gonna inspect the alignment of the shoulders. They should feel even and midline, the iliac crest, and then the gluteal folds. And then we're gonna assess the range of motion of the cervical spine. So you can turn back toward me. Flexion, I'm gonna have you bring your chin to your chest. And then I'm gonna have you look up toward the ceiling. Rotation, I'm gonna have you look over one shoulder and then look over the other shoulder. And then wait, I lost my spot. Okay, and then I'm gonna have you bring your ear to your shoulder and then do it on the other. That tests lateral bending. And then the rest of the spine, we're gonna test. We'll do the flexion. I'm gonna have you bend forward and try to touch your toes. Okay, and then you can come back up. For extension, I'm gonna have you bend back as far as possible. Perfect. And then for rotation, I'm gonna have you rotate from side to side. And then lateral bending, I'm gonna have you bend from side to side at the waist. Now, if this were a different patient, then you could put your hands on them, you could support them, hold their back as they're bending forward, support their spine as they're rotating from side to side, but it wasn't necessary with them. And then his hips. Again, we're inspecting his gait. That's happening when you're walking into the room. And during the other assessments, you're wanting it to be a smooth, continuous rhythm. You're looking at his stance. You're looking at the swing of his gait when his foot moves forward and is not bearing weight. You're looking at the base, which would be 2 to 4 inches at his heel. And then the pelvis shift, his stride length, and his knee flexion. As he was walking around the room, I didn't see anything abnormal. Everything was smooth. And then I'm going to inspect the lumbar spine. You're looking for lordosis, any sort of spasms. And then we'll go ahead and look at the length of his feet. So I'll have you lay down on them. Let me adjust the camera. Okay. So to test hips, we're also going to be looking at the length of his feet. So you put your feet together, put them straight up, and then you would see if there were any kind of abnormalities in length. And then you would be inspecting the hips, looking for any sort of, looking at the surfaces for any signs of like atrophy, bruising, any kind of masses, nodules, anything like that. And then we're going to assess the range of motion of his hip. So flexion, I'm going to have you, I put my hand underneath his hips, and then I'm going to have him bring your knee to your chest and then pull that knee into your chest. Okay, and then you'll do it for the other one. Okay. And then for extension, I'm going to actually have you roll over onto your stomach. And then you're going to go ahead and bend your knee. And then you're going to bring that leg up. Yep. And then do it with the other one. Okay. And then go ahead and roll back over onto your back. Okay. And so to test adduction, I'm going to have you move this leg toward your midline, holding this leg straight. Okay. And then the other one. And now the legs would cross. Okay. And then we're going to test abduction. So we're going to move your leg away from midline. So you would bring it out. And then obviously if we weren't on the couch, you would do it on the other side. And then we're going to test internal and external rotations. So I'm going to have you flex your leg at 90 degrees. I'm going to support your leg here and then your ankle, and we're going to rotate it in and rotate it out. Okay, and then the other one. Rotate in, rotate out. Okay. And then we're going to go ahead and evaluate his knees. So again, I'm looking at his gait. When he's walking into the room, everything should be smooth. It should be, a smooth, gait when he's walking in. And then I'm going to inspect his knee. I'm going to look at the alignment and the contours of his knee. Any signs of bow legs or knock knees. I'm going to look at the hollows around the patellars. Any kind of swelling around the knee joint, in and around the knee. And then I'm going to look at the quadriceps, looking for any kind of atrophy, any bruising, anything like that. And then we're going to assess the range of motion of those knees. So I'm going to have you bend your knee. And then you're going to straighten your knee. And then with the other leg. Bend your knee, straighten your leg. And then the ankles and feet. So with the ankles and feet, I'm going to also be looking at any sort of deformities, any nodules, swelling, calluses, corns, anything like that. And then we're going to assess the range of motion. So I'm going to have you point your foot towards the floor. Okay, and then I'm going to have you point your foot toward the ceiling. Okay, and then I'm going to have you turn the sole of your foot inward toward midline and then outward. Perfect. While they're doing any of these kinds of movements, you're looking for any kind of pain, discomfort. You're going to be looking at their facial expressions in case they don't give some sort of outward display of discomfort. You're going to listen to any like popping of the joints, anything like that. And that's it.